Good afternoon, everyone. Good afternoon. Good afternoon.
Good afternoon.
Okay, so it is 1 o'clock, so we will start our session. You are all welcome. Thank you so much for taking the time to join our webinar today. My name is Elma Kontomen, and I will be the moderator for this session. I will first ask that we all kindly mute our microphones throughout the session. So if your microphone is on, I would kindly ask that you mute it so that we can have a smooth session. Thank you very much. So today's session is the first of 3 exciting webinars we'll be having on consumer food safety education. The next session we have will be on the July 13th. So if you haven't signed up, we will encourage that you signed up if you are yet to. I will put a link in the chat for you to register if you have not signed up yet. A few things we're asked to note before we go on. At the end of the presentations, I will share a link in the chat room. It's a survey, and I will kindly ask you to fill the survey. It will also be sent to you via mail in case you miss it. For those who are requiring a certificate for CE credit hours, there's a request for an email address in the survey for us to send it to you. The next is the sessions will be recorded and will be made available on our website. I will share a link to our website and other social media platforms at the end of the presentation. Lastly, kindly type your questions in the chat. I'll be taking note, and during Q&A, convey your questions to our speakers. Once again, I welcome you all to today's session. At this juncture, I will introduce our speakers. The first speaker is Dr. Londa Mwadike. She'll be taking the first session. A brief profile on her before I go to the next speaker. Londa Mwadike is an Extension Associate Professor and State Extension Food Safety Specialist for both Kansas State University and the University of Missouri. Since 2013, she has been in this unique joint appointment where she works with county and district extension personnel and other stakeholders in both states to develop programming and resources in food safety and related areas, including food systems. She primarily focuses on food safety issues related to produce growers, farm markets, vendors, and consumers. She grew up on a family farm in South Dakota and has worked for the United Nations Food and Agriculture Organization based in Rome, Italy, and also for the University of Vermont. Our second speaker is Dr. Shannon Coleman. Shannon Coleman currently serves as an assistant professor and state extension specialist in the Department of Food Science and Human Nutrition at Iowa State University. Coleman's extension and outreach work includes developing and disseminating food safety curricula and resources for emerging very small and small food manufacturers in Iowa. Using various evaluation theories, her research evaluates food manufacturers' attitudes, intentions, and behaviors towards following food safety practices. In addition, Coleman has expanded her outreach and research to fill gaps in improving food safety and the local food system from farm to table, including developing curriculum and resources for youth, adults, and gardeners. Once again, welcome our speakers. The floor is yours now.
Great, thank you very much, Alma. And thank you to all of you for coming. It's wonderful to have such a great crowd here today, and we're really excited that you all could join. Zoom has made it, well, I'll say COVID has made us all get a lot more comfortable with Zoom, I think, and it enables us to work with people from across the US, which is great. So, and actually, if you don't mind, would you mind, we're just kind of curious who's here today. So if you wouldn't mind just putting into the chat where you're from, it's always kind of fun for us to see what states people are from. You don't, just the state mostly is what we're interested in, but if you don't mind, great, they're starting to pop in, so wonderful. We'd love to hear where everybody's from. Great. Wonderful. We got people from all across, and I see one from Ghana. That's wonderful. So we're really glad that all of you could join today. Great to have you all on. So this webinar series is organized, like Elma said, it's organized by our North Central Region Food Safety Extension Network. So our extension colleagues from across the North Central region have been working together since about 2016 to work together in the area of food safety. And we did a webinar series like this last summer, and we're doing another one this summer, and we're glad to work together on this. And Alice, do you have a question? I see your hand is raised. Allison? Or maybe she inadvertently raised her hand too. Okay, we'll keep going. If you do have a question, like Elma said, please feel free to put that in the chat, and then we can make sure that we can address that. So I'm gonna start by sharing my screen here. And again, I'll just reiterate what Elma said. If you would like to get continuing education credits for your time today, whoops, I didn't go to the right slide. Then you can fill out the survey afterwards, and we'll make sure that you get a certificate that you can use to demonstrate that you attended the session today. So, as mentioned, I'll start by talking about donating safe and nutritious food to food pantries and soup kitchens. And again, as Elma said, I'm with both Kansas State University and the University of Missouri. I have a joint appointment between the two universities, which works out great in many ways. So so the fact sheet that I'm mentioning here, of course, I'll put that in the chat later. Unfortunately, I can't get to the URL right now, but I'll put that URL in the chat later so that you can access that publication. So we developed a fact sheet back in, it was in 2018 now, but the information is still accurate. So this fact sheet can be used. And we also have a leader's guide that goes along with this fact sheet. So if you ever want to teach this in your own state or in your own locality, you could use the leader's guide to help with some ideas for teaching it. And then the fact sheet is something that you can hand out to the attendees at the event. So so we'll put that in the chat for you later. But it's available on both our K-State and University of Missouri Extension websites. So so today, and I'll be starting off our presentation, and then I'll be handing it over to Dr. Shannon Coleman. So Dr. Coleman will talk more specifically about produce donations to food pantries. So I'll kind of talk more generally about donations, safe and healthy donations to food pantries and food banks. So I'll talk a little bit about just donating food in general. Then we'll talk about what you can donate, what is a good idea to donate, and what you should not donate to food pantries and food banks. And then I'll talk a little bit too about donating to like soup kitchens and that sort of thing as well when at the end. So when we think about community food donations, so really it's a great way to help people that just don't have enough access to food, and for them to be able to access food more readily. There's also, it's a great way for neighbors to help neighbors. I know I have 3 young kids, and we donate food as much as we can, and we talk about that a lot, that it's important for us to help other people. In fact, just this morning my kids were having a discussion about they want to get paid for helping this person and that person. I said, well, it's important for us to share with other people, because there's times when other people share with us, and we appreciate when they share with us, and so that we also need to share with others. So so food donations are a great way that you can instill that in everybody, but especially with kids, they can help understand that tangible donation that they can see and feel. It's and again, a great way to help instill the values of caring and sharing, and really helping each other out, because, we never know when we will need assistance, and then we can help others, provide assistance when they might need help as well. One note that I will make, and this goes for consumers as well as for businesses, but the Bill Emerson Good Samaritan Food Donation Act in 1996 was passed so that it would help to reduce the liability if companies in particular, and also individuals, are giving food donations, to a charitable entity. It would reduce their liability as long as the donation is made in good faith. And, thankfully, most people are doing things in good faith. I mean, they're not intentionally donating food that they know is harmful. They're donating food that they, feel like is safe. And so we'll talk about that more later. But it is important that, that this act is in place so that that you will not have to feel worried about, a lawsuit against you if there ever was a problem. So we really just want to encourage people that, again, if the food is safe and nutritious, please donate it. And we have a website that I'll list at the end. And others of you may have seen this already, the food waste reduction hierarchy. So the EPA has a pyramid of food waste reduction, and so the first thing on the top of the list to reduce food waste is to, just reduce it at the source. So not have so much food waste. But, that one of the next things on that hierarchy is to donate the food to other people. So to feed people with that food instead of it going into the landfill, which is our last choice. The choice after just reducing that food waste is to share it with other people. And then it would be sharing it with feeding it to animals, and then it would be composting. So, but just keeping in mind that, a great way to help reduce food waste is to donate it to other people that can use it. So speaking of food waste, I guess I already kind of mentioned this, but it is very important that we think about how much of our food is wasted. And so there's been a lot of research done on this topic of the massive amount of food waste in the US and around the world. But in particular in the US, we have so much of our food supply is wasted. So, so we think about 30% of our food supply is wasted at the retail and consumer levels, which is awful when you think about a field of strawberries or whatever it might be, and how much work farmers put into raising that food, and how much work the food processors make in producing the food or processing the food, all the work of transporting the food, all the energy expenses of transporting that food. And then to think that 30% of that is wasted. So, it's just an astronomical number that we really need to work together to reduce. And so again, at the end, I have a link to another fact sheet that we have on reducing food waste, which is, again, just such an important topic because it affects so many things. Again, all the water that we use to raise food, that 30% of it isn't eaten, all the energy, all the time and effort and labor. So we really just need to work together to not allow what's in that picture to happen. We do not want food just getting thrown into the trash. We want to eat it when we can, when it's still safe and healthy. So we also want to think about, food pantries don't want to waste their food either. And they don't want to have lots of wasted food around either. So, and I have to admit, I've done this before as well. My kids might have a food drive at school, and, maybe there's a competition for which class brings in the most food donations. So I think, okay, what do I have in my cupboards that I'm not really eating? And I remember very specifically one time, I had a can of sweetened condensed milk that I bought on accident in the cupboard. And I thought, oh, okay, we could just give that sweetened condensed milk. And not that sweetened condensed milk is a bad thing, but is that the best thing to donate to a food drive? Is that the thing that's going to be most necessary? So we really have to think about donating that safe and healthy food to food pantries. So so the next slide here talks about what we should not be donating. And so my example again of what I do, sometimes when my kids have a food drive at school, you might go through the cupboards and say, oh, well, this has been in here for, 2 years or something like that. Maybe I should just donate that to the food drive, or it's past the best by date on the product. And again, that's not a best practice. Again, on our food waste website that I mentioned earlier, we do have a fact sheet on there that talks about food product dating, because food product dating is something that's very hard for consumers to understand. So, and I know other extension services, not just ours, has information on that, but it's important for consumers to know that just because food is past its sell by date in particular, that doesn't mean you can't eat it anymore. It just means that it's, maybe it's been around for a while. If food is past its best by date, that's really more of a quality date than a safety date. But it indicates that the food has, it's been a little while since it's been produced. We don't know exactly what conditions it's been held under. So, as a best practice for donating food, we don't want to donate food that's past its best by date or past its sell by date. But it is basically okay for pantries to still use that food, and it's okay for us at home as long as that the food hasn't been if it's a perishable food and it's been sitting out on the counter for more than 2 hours, then you have to throw it away. Then it's not safe. But if it's a non-perishable food and it's past its best by date, the safety, again, depending on the exact situation, could still be okay. So again, we have other fact sheets too on storage times for foods, because that's really a better indicator. How long you've had that product will indicate to you, is it getting to be past the time that it should be eaten? So just try to eat it before that as much as possible, or try to use it, I should say. Okay, so spoiled food, moldy food, hopefully that's pretty obvious, but, just maybe a reminder, if the food is getting spoiled or moldy, don't donate it, compost that. That's a great time to compost those foods. Home canned foods, I'm sure that all of you on this webinar, when you're canning, you're using safe methods and you're doing a good job. You're using safe tested recipes. But unfortunately, we don't know that everybody is using safe methods and using safe tested recipes. So it's just, it's better to not donate any home canned foods, because we just, the food pantry won't know if you're actually using those safe practices or not. So it's just a best practice not to donate those things. Again, our extension services across the US have great resources on home canning. We encourage you to use those to do it safely. If home prepared foods, if I baked some cookies and I had extra, maybe giving those to your neighbor is a better option than or bringing them to the fire department or something like that might be a better option than donating it to a food pantry. Again, just because, hopefully we are all using safe practices, but we don't know that everybody is. So it's just risky for food pantries to accept that. Foods that's been opened or repackaged. So, if you have a big bag of cereal and then you're putting it into a smaller bag, unfortunately, we just don't know what else might have gone into the bag. So, just food pantries shouldn't be accepting any bags that have been opened or that have been repackaged, because you just don't know if somebody else put something in there, whether it was intentional or unintentional. There could be other not good things in there. So we don't want to donate foods that have been opened or repackaged. Dented cans and damaged packages, generally speaking, no. I do have a great flow chart here from North Carolina State, from our colleagues at North Carolina State Extension. And again, at the end, I'll have a link to their website. And you can see it's complicated. The answer is, can I use this can? There's a lot of questions you have to ask. And this is, again, mostly for food pantries, but you can use it for your own use at home as well. So you have to think through, is it dented? How dented is it? Is it a sharp dent or is it a small dent? So you can see there's a number of questions there that you should go through and think through first before you decide to use that can. And you can see, you have to answer a lot of questions properly before you can get to the, it's okay to use that can. So there's a lot of reasons why you would not use the can. It's better to be safe than sorry. But if you are going to use the can, we want to make sure that it's safe. It's always this balance of, it's not worth risking your health or anybody else's health just to save, a little bit of food from being wasted. It's, again, we want to reduce food waste as much as possible. I'm very frugal myself. I don't like to waste money. I don't like to waste food. But we also have to remind myself, once in a while I will get a little, stomach discomfort or my kids get sick. And then I think, okay, Londa, was it worth it? Like saving that one little food item, not throwing it away, but instead eating it. Like, was that worth it to get sick? We don't want anybody to get sick unnecessarily. So, so we just have to balance out the food waste and food safety as much as possible. Okay, so the next category here is things that are under the category of it depends. So unfortunately, there's a lot of them that you have to look into it a little more. So fresh fruits and vegetables, are great. We all should be eating more. I think I can't speak for everybody, but I know I should be eating more fresh fruits and vegetables. And I think most Americans are like that. We all could probably eat more fresh fruits and vegetables. But the problem is that, not all food banks and food pantries can handle fresh fruits and vegetables. They might not have proper storage. Some fresh fruits and vegetables really should be refrigerated. Lettuce, leafy greens, they're not going to last very long if you're leaving them at room temperature. And they need to be stored in a sanitary manner, especially foods like fruits and vegetables and berries that are not going to be cooked before consumption. So, check with your local food pantry to find out if they can accept fresh fruits and vegetables or not. And again, Dr. Coleman will be talking more about donating fresh fruits and vegetables. So refrigerated foods or foods that require refrigeration, if you end up with some extra juice boxes or something that require refrigeration or, extra, let's say milk or something like that, and you want to donate that to your local food pantry, you always have to check to make sure that they have refrigeration capacity, because not every food pantry does. And the refrigerators can fill up pretty quickly. So always check to make sure that they can handle, whatever volume of refrigerated foods you might be wanting to donate. Frozen foods, again, the same. They might not have that freezer capacity to be able to handle it. And so check to make sure they have the freezer capacity to handle it. And then also, if you have let's say you have some chicken breasts that have been in your freezer for a long time and, you're thinking about getting rid of them. If the package is still sealed, of course, we don't want to be donating anything that's been opened. But if that bag of chicken breasts has some large ice crystals in it, that means that there's a good chance that it was what we call temperature abused at some point. So that means the temperature, got up above freezing for a while. And then it and then maybe you refroze it and it got, refrozen. So unfortunately, in that time when the temperature got up above freezing, if it got up above refrigeration temperatures, then, you could have easily had some microbial growth at that time. And then those microorganisms could still be there even after freezing, because freezing wouldn't kill that. So if you see large ice crystals in frozen foods, it's an indication that there's been, some temperature abuse. There could be some, pathogenic growth, microorganisms that can make you sick growth during that time. So always check that. Meat and poultry, this is another question we get often. If people got a deer, then what do they, can they donate that or not? Or if you, slaughtered some chickens in your backyard, had some extra, if you wanted to donate that to the local food pantry. The requirements, at least in Kansas, and I'm quite sure that the requirements are the same. Definitely the best practice is the same, that the meat and poultry have to be from a licensed processor, because we want to know that, it was processed in a sanitary manner, that it wasn't just done in the backyard without very good sanitation. So again, always check with your food pantry on those things. So what things should we donate? I've talked a lot about things that we should not be donating, but the things to donate, non-perishable foods is always, an easier answer, as long as it's not past the best by date. Nutritious canned and packaged foods, definitely those are great donations. Monetary donations is also a good thing to donate to food pantries. Again, it doesn't have that quite the same tangible nature of, like my kids understanding this food is going to help somebody else. But, in many situations, monetary donations are a good choice, because then the food pantry can buy in bulk, and they can determine what their greatest needs are. Maybe it's for a particular kind of food that people are always asking for. Then they could buy that, and they can probably buy it in bulk and get it cheaper. So, and then they don't have to spend time sorting and that sort of thing. So that's a good option also. Volunteer time, especially during COVID, volunteerism, I guess, at volunteer hours at food pantries really plummeted, because a lot of volunteers are often from vulnerable population groups, elderly populations and so on. So again, volunteer time is always appreciated by food pantries. And I know I feel like I'm talking about my kids a lot, but my kids and I did volunteer to work at our not a food bank, but like it's called Joy Closet, but it's another donation center. It has a store for household goods and clothing. And it was such a great experience for us to do that. It was a wonderful experience. So we just did that recently. So, it's a great experience for people to volunteer at food banks and food pantries. Okay, so just thinking about what to donate, really have to think about what foods should people be eating in the first place. So thinking through the My Plate, what are the foods that people should be eating more of? So vegetables and fruits are things that we all should be eating more of, like I mentioned before. So those are things, we should make sure we try to donate fruits and vegetables. And of course, grains and proteins are great as well, but, we should make sure that we're not just donating, from one of these food groups all the time, but that we are donating, from all the food groups, so people can be getting a variety in their diet. This is a flyer that actually our K-State Extension SNAP Ed program, the Supplemental Nutrition Assistance Program, education program, developed a few years ago. But I think this is a great flyer that just kind of helps people think through, like, just some ideas of things that I could donate that are safe and healthy, because sometimes we don't always think about, oh, I could also donate something like granola bars, or I could donate non-fat dry milk. So, these are just kind of good, helpful things to think about, what might be helpful. And always thinking too about, gluten-free options or dairy-free or nut-free items as well. Because, people might have those needs, but, those kind of foods are harder to find, and they're often very expensive too. So, just thinking through all the different people that might be using a food bank, and just thinking through how we can help everyone to find safe and healthy foods. So I just have a few slides left here. As I mentioned, I do want to talk just briefly about donating to soup kitchens. So I'm familiar with the regulations in Kansas. In Missouri, the regulations differ depending on each county and city, so it's a little more complicated. But so you'll have to check with your local your local municipality or your local, your state's regulations to see what their regulations are. In Kansas, they've been talking about developing some regulations, but it just hasn't happened yet. But so these are best practices in any case. So, again, you should check to see for sure what the regulations are in your area. They might be more strict than this, but these are, best practices. And again, donating foods that are prepared under license. So, meaning if maybe you had a big, a big party for your family and you just cooked all this food, and then you wanted, the food that you cooked, not under license, but just that you cooked in your regular home kitchen, that's not the best type of food to be donating to soup kitchens, because again, hopefully you're using good practices, but the soup kitchen doesn't know that for sure. Some people might not be using good practices. And so, it's better for the soup kitchen to only accept food that has been prepared under license, just so that they can have more assurance that that food was prepared safely. And you want to make sure that the soup kitchen, again, wants to make sure that, it's been prepared safely, handled safely, that there was good temperature control, that the food wasn't sitting out for 4 hours at room temperature, that it was held in food safe containers. Garbage bags are not food safe containers. And that it wasn't food that was like sitting out on a buffet and people were spooning out of it, that it's food that was prepared, but, was not actually, set out on a buffet or was not set out on a table for people to eat. So, so again, we don't want to waste food, but we also don't want to make people sick, especially the vulnerable populations that are often using our food banks are potentially more susceptible to foodborne illness. So we want to protect them. So, food pantries and the people they serve are grateful for donations. But we do want to make sure that they are, our donations are safe and nutritious foods, to make sure that they can have, a better diet and a healthier life. So, just always keeping in mind who's going to be receiving those foods, and again, thinking that, they could be vulnerable populations, the young, the old, the pregnant, and the sick. We want to make sure that they're getting the safest, most nutritious food possible. So here's some great websites. Like I mentioned, the North Carolina State has some good information, for food banks and food pantries. University of Wisconsin, our colleagues also have some great information there. And then from University of Missouri and Kansas State University. So again, we have some food waste information as well that again, this all kind of fits together into that whole package. So, and here's my contact information. And if you have questions or would like more information, I am happy to help you with that. So I'm going to stop sharing here, and I see there's some things in the chat. So great. All right.
Thank you, Dr. Madike. Thank you.
All right. So I will go ahead and get started for us on my end. Welcome to the webinar that is going to cover produce safety for donation gardens. When working in your own personal or donation garden, you want to make sure that the fresh produce that you're growing is fresh, but also safe. And so this presentation will cover recommendations for best practices to follow in the garden. So we're going to start off with some learning objectives for this presentation. And the first one is to identify food safety risks that could lead to cross-contamination in the garden. And then the second one is to illustrate the proper hand washing procedure. So in the middle of this presentation, I'll have some steps that goes through hand washing. So it was reported that that foodborne outbreaks had increased with about 43% of foodborne outbreaks between 1998 to 2008. They were attributed to fresh produce and nuts. And the image you see here came from the Water Quality Health Council that shows that 29 recalls in the United States from 1989 to 2017 were related to fresh produce. It was reported that the highest number of recalls were with fruits, nuts products, accounting for 11, which is translated to 38% of recalls. Although fresh produce, although you may not be growing fresh produce for overall public consumption, you do want to make sure that you're following safe practices in your home garden and donation garden, because as Londa mentioned, there are vulnerable populations that frequent the garden, the pantries. And so here is a resource that I developed along with our Growing Together Iowa program. And this was developed for master gardeners and their community partners to remind them of safe produce safety practices to follow in the garden. And so in the next several slides, I'll go through each of these and provide some backgrounds and the why behind why we pick those topics to specifically address. So our first one is produce safety concerns with animals. So domestic animals, due to their proximity to humans as well as wildlife, are more likely to harbor human pathogens. And so when you're assessing the risks associated with domestic and wild animals, it is essential to understand that they are a food safety concern, that they can carry human pathogens in their feces, and they can spread to your gardens and your fields as they move through it. And so knowing this is important because you want to limit their access to your fields, your gardens, to make sure that they're not contaminating your fresh produce. So using appropriate water sources. So pathogens can be introduced in water easily Therefore, it is very important that you should understand the risk that water can cause, and it's important to work on reducing those risks. So without water, fresh produce cannot be grown. So knowing how to manage your water quality and the proper use on your garden is critical to reducing produce safety risks during the production of fruits and vegetables. So when we talk about water quality, it's based on the sources of water. And these are the three sources that you see here: surface water, ground, and municipal water. And so there's also risk that are associated with it. And so because of the audience that we are working with at these food pantries, you want to make sure that you are using water that is lower risk instead of the higher risk. With those higher risk water sources, if that's the only source that you have available for you, it needs to be tested often to prove that there is no foodborne illness associated with them. So workers with improper practices, hygienic practices with water, soil, animal feces, organic matters can lead to the transmission of foodborne pathogens to the environment. And so one of the items and equipments that are being used by these workers is also something that you want to make sure that is appropriate for the food contact surfaces. And so this is talking about your fresh produce. And so when we talk about your containers and equipment, you want to make sure that they follow the standards that are listed here, that they're non-toxic and non-absorbent, that they're durable and could handle corrosion, and then Also want to make sure that they're easily cleanable and sanitized if possible. So clean is essential, sanitize if possible. As a gardener, you want to make sure that you're not transmitting any foodborne pathogens to your family, friends, or even community when we're talking about the pantries, and that you want to have an effective cleaning and sanitizing policy when it comes to your containers and equipment. And so hand washing is key when we're talking about working with volunteers in your garden, yourself. And so that is #1 way to reduce the risk of infectious bacteria and viruses in your garden. And so listed here are the proper steps for hand washing that is listed by the Center of Disease Control and Prevention, the CDC. And so I always start off with step 1 because a lot of people, when they start washing their hands, they turn the faucet on and they grab soap first. And so if we go by these recommendations, you should be starting off with wetting your hands with clean running water, and then apply soap to your hands. And then you want to lather your hands using that soap, and making sure that you're getting the back of your hands and between your hands and between your fingers under your nails, and that you should be scrubbing for about 20 seconds. About a month ago, I spent some time at New Mexico State, and my colleague has a video about hand washing. And so she went through 4 seconds, 10 seconds, and 20 seconds. And somehow I ended up interacting with the video and started talking about making sure that the person that they scrub their hands very good, and also get those nails, because they use Glow Germ as their indicator of whether the hands are being properly washed. And so making sure that you scrub it for 20 seconds and getting all parts of your hands. And then after that, you want to rinse your hands thoroughly with clean water. And then finally, you want to dry your hands using
Safely handling and donating produce.
clean.
I just had a few minutes, so I thought I'd come by and
Make sure that you are muting yourself. So Londa and Elma, y'all may have to find that person and mute them. Use a dry and clean paper towel, or allow them to air dry. And so we have a graphical resource here that we usually use during our trainings, that we also give as a giveaway, that we laminate, and that people can put that out in their gardens to make sure that people are washing their hands. And so people always talk about washing their hands, but knowing when to wash your hands is also important. And so here are some suggestions that you can do during your trainings with the volunteers for your garden and everything, to make sure that they know when they should be washing their hands. And so, of course, before and after using the toilet, facility, before returning back to work, before and after eating and smoking, and then also making sure that you wash your hands anytime it becomes contaminated. So if your hands end up getting heavily soiled because you are working in the garden, making sure that you're taking the time to wash your hands in between that. And so bruising and puncturing and damaged and drop produce are a big issue when we talk about the produce that you want to donate to the pantries. And so the reason why it's such a big issue is because where there is damage or bruise to that produce could serve as a possible route of contamination for that produce, such as the stomata, the roots, and things like that. And so you want to make sure that if you have those type of injuries, that you want to not use that produce. If the surfaces of that produce is used as a protective barrier, and so once it's punctured and bruised, you're now opening it to sources of contamination that could compromise the physical and biological setup of that produce. Transportation to those pantries are also important to consider. And that is that you're trying to find the best source of transportation to make sure that the produce is not being recontaminated on its trip to the produce itself, to the pantry itself. And so things to consider with that is, number one, using a clean covered transportation. And that is using either a large SUV, adding tarps to your truck bed, or even using a bed cover to make sure that you're covering that produce while it's on its trip to the food pantry. And then also making sure that vehicle has been cleaned and sanitized, especially if it's a multi-use vehicle. So if it's been used for carrying manure, animals, anything like that, you want to make sure that you clean and sanitize it before you use it for those, for taking it to the pantry. And then finally, for our recommendation is your workers, making sure that they have appropriate personal hygiene and cleanliness practices in the garden is essential. And so listed here are some ways to reduce biological and physical hazards in the garden. And they go as follows. So tying your hair back, so making sure you have some hair restraints, especially if your hair is long. Not eating or smoking in the garden. And then next is making sure that no one works when they're sick. And with foodborne pathogens, you're looking for symptoms such as fever, diarrhea, and vomiting. Next, you want to also make sure that they're not wearing jewelry, because jewelry the diamonds and other precious stones that are in your jewelry could serve as physical hazards. And then last, making sure that they wear clean clothing. Dirty clothing can transmit foodborne pathogens. Actually, we recently got a request from someone in the apparel department that want to look at clothing and microorganisms. And so it's starting to spread over into that industry as far as looking at whether those items can, looking at the risks that are associated with those items. And so I also want to take the time to outline some of the programming and resources that we have at Iowa. So some of our food and health specialists who are on this call today are also going out this summer to deliver Produce Basics. And it is a program that participants will learn how to prepare fresh produce and using easy information that will be provided to them. And so they will learn how to store, clean, prepare, and preserve fresh produce. And so this program involves a lecture, interactive activities, and a food demonstration. And one of the activities that they are doing as a part of that program is comes out of our Produce Safety in the Garden curriculum that's available on our extension store. And they interact with the food safety scenario activity where they have a volunteer that's following some unsafe practices. And so they work on identifying the risk and corrective actions associated with that incidents, the scenarios that volunteer has put them in. And that is wrapping up our presentation. We talked about identify some of the food safety risks that could lead to cross-contamination in the garden, and then I illustrated the proper hand washing procedures. And then here is my contact information if you have further questions.
Thank you. Thank you, Dr. Coleman. Thank you. So we would move straight into Q&A. We have about 12 minutes, so we can move into Q&A. There was a question about, can master food preservers donate food that has been prepared in a certified kitchen? I guess that would go to Dr. Wadike to answer this question for us. Please kindly type your questions and I will convey it to the speakers. Thank you.
Yeah, thank you. That's a great question. The answer, I feel like I say this all the time, the answer is it's complicated and it depends. In general, the regulations in every state are a little bit different. So, you have to check with what the regulations are in your state. So, and you know, the term certified kitchen, that's also complicated. Because generally speaking, at least, you know, in Kansas and Missouri where I work, you know, a license is tied to a particular person making a particular product in a particular place. So, you know, so if something is going to be considered inspected, then it's, you know, it's not just that the kitchen, you know, like it's a restaurant kitchen or something. It has to be that that kitchen has been approved to make that product, you know, and that person or group has been, you know, okay to make that product. So, but I know I get this question here in Kansas too, and what Kansas Department of Ag has said is that they, you know, they really feel like it's better that the product is made under inspection, because then they, like I said before, you know, we think that the people are going to use safe practices, but you know, we don't really have any way of having a kind of demarcation of, yes, they're using safe, you know, yes, we feel like they're using safe practices, or we're not sure if they're using safe practices unless they've been inspected. So, so again, you know, I'm sorry, that was a long answer, but just check with the, check with your state to find out what they say. I think it's a great idea, but you know, unfortunately just check with your state to find out what they say. Sorry, that was a long answer. Hope that helped though.
Great. There's another question. Aside from the Good Samaritan law, can organizations and or individuals get the receiver, that is the food pantry, to sign a hold harmless agreement?
Yeah, another great question. So I do know, and I just reviewed one of these the other day for the food pantry at Kansas State University, like the campus food pantry. They asked me to review one of those. And I'm not a lawyer, so I, you know, cannot say from a legal perspective. But I will say that, I mean, I know that pantries do that. And like I said, I did review theirs, you know, from a content perspective to give my input on a content perspective. So, and, you know, I mean, maybe you could check with them if they're willing to share it. I was just going to say there might be others that are willing to share if they have like a template like that, you know, kind of a hold harmless agreement. But anyway, that's what I can say, I guess, on that one. From my food safety background, not my legal, I have no legal background.
Great. There's another question. You can still type your questions in there. We still have about 9 minutes to go. So if you have any question, it's direct to Dr. Coleman or to Dr. Mwadike, you can type it in the chat. The next question says, do you have any specific recommendations for free little pantries, like little free libraries where the cupboard is outside?
Yeah, and Dr. Coleman, by the way, if you want to jump in on any of these questions, feel free to, but I can start with this one. And if you want to jump in, Dr. Coleman, please feel free to go ahead. But in fact, as I was presenting, I was thinking about talking about that, and I decided not to, because I keep thinking about, I keep wanting to develop a fact sheet on that very topic. And I haven't yet. I haven't developed that fact sheet yet, so I'm not quite ready to share that information yet. We've been answering questions on that, and I mean, the church I go to has one, and I think it's great. Like, we donate stuff in there all the time because it's so easy. You know, it's open all the time. I can donate stuff anytime. You know, it's easy to donate there. But I freak out when I see people donating produce at the blessing box, because you know, and especially a lot of times the produce, and again, I see other blessing boxes around town too. The blessing boxes, quite often the produce is in like a box underneath the blessing box itself. And so the produce is just sitting out there in the open. Like one day I feel like I'm rambling. One day I saw grapes in there, which is great. You know, I mean, it's great that somebody wanted to donate grapes, but like they were just sitting in a box in the open, and it was like 90 degrees. And so, you know, that's not a good practice. So, so I've been wanting to develop a fact sheet, and I have it. You know, we also think about, you know, even canned foods. If it gets too hot, it's not good for canned foods either, because the, you know, the chemicals on the inside of the can can even leach into the food products. So, and you know, breads, like, you know, they shouldn't be getting up to 90 degrees either. And then they get wet, or what's the right word? They condensate, and then, you know, mold can grow. So, so yeah, yeah, and exactly. Then when it's cold, then you have the opposite issue of the canned food freezing. So, so yeah, it's a great question, and I just haven't gotten that fact sheet ready yet. And maybe somebody else has. I haven't found one, but if anybody else has any comments, go ahead.
Yeah, and this may just be an opportunity that those who want to do that type of work, that you can connect with your local extension state specialist and kind of talk through with it. We recently had started a conversation and then it stopped. So I'm with you, Wanda, when they talk about those community refrigerators, and like the health and the food inspectors were there. And I was like, this is a great opportunity to sit down and talk to them and say, we want to do this. We want to be helpful to our community. How do we do this and do it safely? So, you know, engaging in those conversations with the appropriate people just to make sure that you're doing it safely. I understand that there's a need out there in the community, but you don't want to make someone sick in the process of trying to do a good deed.
I'll just say really briefly, I know I try to kind of, like, whenever I go past the blessing box, like our church, like I try to, you know, check and see if there's like moldy sprouted potatoes, and I take them out, you know, I kind of, so, but yeah, we need to keep working on that. So just like Dr. Coleman said, it's a great topic that we need to keep working on.
Yes, great, thank you. Please, I'm sharing a link to the survey. So please kindly fill the survey. For those who would want a certificate for CE credit hours, you will be getting that from this link. So please kindly fill it. We have a few minutes to close. Any other questions we can take? The recording will be shared on our website. I will share a link to our website and our social media platform so that you can just go there and then pick it from there. It will be shared right after. We try and post it on our website as soon as possible so that you get access to it, to this webinar.
I'll just mention, I know I put it in the chat, but like some of the questions that were asked, you know, that food waste website that I put into the chat earlier. Oh, and I see another question here. That food waste website does have a lot of resources. I don't know if we had one specifically on like that hold harmless agreement, but there's, you know, we have links to other universities' websites too that might have some good information. And Dr. Coleman, I see that a question came in about using or reusing boxes for produce movement. Do you want to take that one?
So we try to say in produce safety in general, just if you're reusing, I think reusing plastic containers, like hard plastic containers that could be easily cleaned and sanitized. If it is a soft plastic, or if you're talking about reusing those strawberry, raspberry containers, you're putting the whole situation at risk, because if there was some source of contamination before, it could move on to your product, which probably wasn't contaminated. So we try to stay away from reusing things that are not easily cleanable.
Are there any other questions?
Yeah, I'll just say briefly on that question. Yeah, for people selling produce, you know, that's a definite, like, you know, you have to use either a liner or cleanable container, or, you know, the first use, you know, it has to be clean and sanitary. But like Dr. Coleman said, for donating, it's a little more, best practices, do the best you can, make sure it's as clean as possible. It's a little harder to really have that tight line in the sand of what's legal and what's not, or what's legal and what's not. But definitely best practices not to reuse them, but we get it too.
Great. This was very informative, Dr. Coleman, Dr. Wadike. Thank you. Thank you so very much. I really loved your can you use a can chat? Very complicated, but very fun and interesting chat that was shown there. That was very interesting for me to see. Check if there are any other questions. Great. If there are no other questions, please kindly fill the survey. I have pasted it in the chat. You can just fill that. Again, the recording will be on our website, and I've shared a link to our website, so you can go for it. Sure, we will send a list of the resource links by email. If you requested for it, we will send it to you. Okay, we will. We'll be sending all the resources to you if you request for it. Okay, then. So thank you all for joining. Thank you so very much, Dr. Coleman and Dr. Wadike. Thank you so much again for your presentations. So thank you all for coming. We will see you on July 13th for the next webinar. July 13th, same time, 1 p.m. Eastern time. Hope to see you all, and you invite others as well. Have a great day. Bye.
Thanks, everyone.